So the two main talks that I'm giving, one I gave yesterday, was called Stop the Carousel, I Want to Get Off, the challenges of managing patients with chronic pain. And what I really did, in sort of a little bit of a comical way, was lay out all of the challenges that face healthcare providers today, in addition to all of the challenges everyone in healthcare is facing with respect to managing patients with chronic pain. Obviously, there's a lot of media attention. There's a lot of work that's involved. There's a lot of things that need to be done that don't necessarily fit into established paradigms. So we have unfortunately seen some people put signs in their waiting room saying, I don't prescribe opioids for patients with chronic pain. If you're looking for opioids, you can't come to me. And that just doesn't work if you're in a rural area where your primary care provider might be the only primary care provider for miles around. So what I tried to do is I tried to list out what the challenges are and give people some ideas of some of the things they should think about while they're attending the meeting this week, to bring back with them so they could actually check off the boxes and have what they need to make it a little bit easier for them. Because we all are hopefully Hippocratic in our desires and goals, and if we did go into healthcare, despite our discipline, we went in with the idea of helping people with their medical conditions, helping comfort them and helping make them feel better. And if pain is the single most common problem they have, it's our responsibility to say we're going to help them. We can't hang up signs in our office and say, I don't prescribe antibiotics, or I don't prescribe high blood pressure medications. It's just as ludicrous to think that people might hang up the sign and say, I don't prescribe opioids. So there's a lot of regulatory scrutiny, there's a lot of media attention, there's a lot of confusion about managing pain, and are pain patients actually the ones who are overdosing and dying as a result of these medications? And the talk was really trying to playfully list these things out and help people think about solutions to them. With respect to what I think patients need to be educated about, I think it is that they have a responsibility with respect to their management of pain. In the old days, medicine was practiced in a paternal way. The healthcare provider, in many cases it was the doctor back then, said, here's what you do, and then the patient's job was to just go and do it. Modern day, 2016, it's much more of a shared decision-making kind of approach, but it's very difficult for a patient to make shared decisions if a patient doesn't really understand how to make those decisions. You wouldn't ask someone to come in and buy a car if they knew nothing about automobiles or they hadn't done any research. That would be a mistake on their part. One of the interesting things about pain is that it's one of the rare medical conditions where a patient gets to have a say in what a successful treatment outcome is. So if they get to have a say, unlike hypertension or diabetes, in what is working or what's not working, it's incredibly important to teach them what they need to know so they can make educated decisions about assessing themselves as well, because they really are. And then, of course, the other thing that needs to happen is they need to understand their responsibility in this story as well. Not only to follow the plan, but if they're prescribed opioid medications, they need to be as responsible with them as they can possibly be, and in many cases treat them like a gun in their home. And from the attendee perspective, in terms of what I would hope they would learn, is that they need to be messengers to other people who haven't received the education and try to latch on to things that they can practically take back in their clinical practice and implement as soon as they get home. PAINWeek's biggest strength is that it puts doctors sitting next to nurses, sitting next to pharmacists, sitting next to psychologists and occupational therapists and sociologists, all in one room, and everybody gets talked to, and we talk with them as if they're a single group of healthcare providers. That's a very unique scenario, and I would also hope that attendees take home the idea that it certainly is going to take more than one healthcare provider to treat and manage a patient who suffers from chronic pain.